Hello and welcome. My name is Rebecca Devlin.
Hi, I'm Cassie Steep.
And we are going to talk about toilet training for students with autism. We know that toilet training is a very important skill to teach. It promotes independence and really makes those daily routines smooth for caregivers, educators, parents, and so on. But we also know that toilet training can be very, very overwhelming. We've had that experience training and teaching toilet training over the years, but with a step-by-step plan, it really is very achievable. Our goal today is to give you a clear step-by-step plan for toilet training to help you with your toilet training goals for your students or the individuals that you are caring for with autism. Autistic children often develop those consistent daytime toileting abilities later than their neurotypical peers. We hope the information shared in this webinar really empowers you to make a meaningful difference by supporting autistic children's toileting journeys with patience, encouragement, understanding, and most importantly, those effective strategies. I wanted to speak about the key areas of support prior to engaging in toilet training with your autistic students, one of them being difficulties with social communication. If you are currently caring for or teaching an individual with autism, you're probably very aware of some support needs around social communication. So that could look like challenges understanding verbal instructions, social cues, or those implicit expectations, which can make it harder for the child to understand when, why, and how to use the toilet. The second key area of support I wanted to speak to is restricted behavior. So we know that toilet training requires a significant change from those established routines. So such as things like wearing diapers, which can cause distress and resistance for autistic children who really do rely on that predictability. Another key support area I wanted to speak to is sensory processing differences. So that could look like a sensitivity to noise, whether it's loud or unpredictable sounds like the flushing of a toilet or echoes in the washroom. There could be fans, hand dryers, all of which could cause fear or distress. Other sensory sensitivities could be lighting, whether the lights are too bright or flickering, or fluorescent lights, which can also be overstimulating. Other things like smell, so strong or unfamiliar bathroom odors, whether they come from cleaning products or waste, can be very upsetting and something we need to be mindful of. And then there's tactile, so things like the feeling of toilet paper, wipes or clothing being pulled up or down, all of which may be distressing and should be taken into consideration with any toilet training program. I wanted to take a moment to reflect with that information to think about how you can make the washroom or the toileting experience more comfortable, or to make the space more comfortable for the child who you are toilet training with. And in this moment, I would ask you to think about a child that you're teaching or supporting, or you have in the past. If they have any sensory sensitivities, how you could potentially modify the environment to make it more comfortable for them. Or just the overall experience. Could you bring in something that they enjoy to the washroom to make it a more comfortable environment, like maybe their favorite music or their favorite toy, or something that will calm them in an otherwise overstimulating environment? So why prioritize toilet training? Toilet training is very important for a number of different reasons. And I think reflecting on the why is important at this point. Oftentimes, toilet training, as we mentioned, is overwhelming. It can be a daunting task. And on those difficult days, if we can anchor the why are we teaching this skill, it gives us the grit and the resilience to keep going. Independence is one of the most important reasons to teach toilet training. It also improves social participation. When an individual is toilet trained, they have more confidence and are able to better participate in social activities, whether it's preschool or daycare, without the input and the help and support of an adult, because they can communicate when they need to use the washroom and independently take themselves to the washroom, which allows them to participate more fully in those activities. It also reduces dependence on caregivers and demand on caregivers too. A lot of time is invested in the toilet training process, whether it's changing diapers or hygiene, which frees up parents and caregivers when independence has been achieved. There's a lot of many other benefits as well, some of which include supporting healthier bladder function, enhancing psychological well-being, and lowering the likelihood of peer rejection as well. I wanted to review some of the stage goals in relation to toilet training. We know it is a developmental process that starts with awareness, the importance of routine, that consistency through scheduled toileting breaks, and then independence. So looking at the child self-initiating and managing toileting with minimal caregiver assistance. You will see a checklist of different readiness skills that we typically look for prior to engaging in the toilet training process. What I would like to say prior to reviewing these readiness skills is you may come across a kiddo who, might have most of the skills. Maybe they're a little bit lacking in one or two, or they may not be as competent or independent. I wouldn't let that hold you back in starting the process. Of course, we would love to check off all of the boxes and ensure all of those readiness skills are there, just to ensure that the student or the individual is successful in the toilet training program, and that they themselves it's not a stressful or aversive experience for them or for the caregiver that is toilet training as well. So with that in mind, some of the readiness skills that you will read here, I would encourage you to reflect on the kiddo that you're teaching or you think would benefit from the toilet training program, and maybe check off yourself, do they have these readiness skills, or identify those areas that they may not be as independent in, and it could be something that you can start off with in terms of goals. But physical readiness, we're talking about bladder control. Can the individual hold their pee for 1 to 2 hours at a time? Meaning, can they stay dry for longer periods? Do they have independence around walking to and from the washroom? Can they walk to the washroom, the bathroom with minimal support? Are they comfortable sitting on the toilet for up to 2 minutes? So anywhere between 1 to 2 minutes. If not, that might be something that you have to work on prior to starting the toilet training program. Are they independent, pulling their pants up and down, or do they need assistance with dressing at this point? And do they have regular or predictable bowel movements? These would all be considered physical readiness skills that you would want to observe in advance of beginning a toilet training program. Communication and awareness. So do they show awareness of when they are wet or they're soiled? For some kiddos, they don't like the feeling of being wet or soiled, and that can be a really good indicator as to their being ready to start a toilet training program. And then for some other kiddos, you might notice an indifference. They're not actually at least showing or communicating any awareness of the fact that they are wet or they have soiled their diaper or clothing. Do they have a communication system? Are they able to communicate their need or their desire to go to the washroom? Whether that's communicating verbally, maybe using some form of sign or gestures, or if there is pictures or symbols or some sort of a picture exchange communication system in place. Do they understand simple directions? So if you give the instruction, let's go to the washroom, do they understand what you're saying? And then as well as following basic routines with support. There's emotional and social readiness, which is also very important. So tolerating sitting on the toilet without distress. This would be an important one if you have a kiddo who is unable to go into the washroom, and tolerating sitting on the toilet without distress would be really important. Do they show any sort of curiosity or interest in the bathroom or the toileting routine? Are they comfortable in accepting adult guidance during care routines? And another one is, can they cope with small frustrations or transitions with the support? These would be considered important emotional and social readiness skills. Behavior and routine skills are also important to take into consideration. Can the kiddo that you are going to toilet train tolerate pausing when engaging in a preferred activity or a play-based activity, pausing briefly just for that transition to another activity? Are they comfortable with predictable routines? How do they respond to things like praise, encouragement, or positive reinforcement? These would all be what we consider behavior and routine skills that we need to take into consideration. And then there's consistency and environment, communicating with the family to determine, are they interested and open to beginning toileting and toilet training programs, ensuring that expectations are aligned between home and childcare or the education environment, depending what your role is or environment that you are in. Does the child have regular bathroom opportunities during the day? That would be important, to have many scheduled regular bathroom opportunities throughout the day. And then staff that are available to support that consistency and patience that is crucial to the overall success of a toilet training program. So I'd like to pause for a moment to reflect on the readiness skills that we just spoke about, and to think about that child that you have, or maybe there's many autistic kiddos in your care that you think would benefit from a toilet training program. But focus on one and review which of these skills do you observe they already have, and which might need more practice before starting a toilet training program. And like Rebecca said, out of all those readiness skills, the child does not need to have every single one checked off. But what it will indicate, the more that is checked off, it will indicate that they're more ready, and you might be able to finish the toilet training program faster and with more success. But go ahead and start it wherever you're at, as long as you feel comfortable with the following. These, as we go forward, are tips on the specific type of strategies that might aid in getting that child to the point where they are independent in toilet training. So we want to start with thinking about the power of priming. So priming is just simply gently preparing that toddler's brain before you expect that you're going to be going into the toilet training routine. So you're not forcing anything. You haven't begun toilet training. You're just like dipping your toe in, planting ideas through any repetition that you have, stories that you might tell, and so that the behavior, when it gets to the time of the hard work where you're going to toilet train, it feels familiar. Some things that you might want to consider when we think about priming is reading the child books where the main character uses the potty. Use phrases that you will use during training, such as pee and poop go in the potty during diaper changes. Again, just getting the child used to the phrases you will be using when you begin the hard work. Let the child sit on the potty with clothes on just to explore it. And also modeling the routine. Maybe you can say, first we sit, then we wipe, then we wash hands. No expectation that the child has to be involved in that. That would be considered priming. And that's one really evidence-based strategy to encourage success for toilet training. And then we want to pause here to talk about why we would have to use some visuals for this population. So why visuals matter. And when you really think about the four following examples, you can get an appreciation for why you will want to be making some visuals. We have some to take away today for you, but they provide very clear, concrete cues that help children understand the routines that are expected, and therefore that reduces anxiety. They're going to assist the child in who might have a language delay or who are not verbal. It's going to assist them in offering the communication that they need to request the toilet and understand that it's time to go to the toilet. It will help caregivers establish predictability and consistency. That is essential. So you're all using the same language, you're providing the same visuals, and it's going to stay the same for that child to help understanding. And then the biggest one I find is important is it will explain to the child when their reinforcement for their job well done will occur. So just keep that in mind. We're going to be showing you a few visuals along the way that's going to assist the child with toilet training steps. So the first sort of step you want to start when you dive deep into the routine is you're going to do some dry checks with praise. So all that means is that you'll take some note on how long the child can stay dry for. So I would start the sort of data collection, if you will, with every 30 minutes, just to say, take a look at the diaper, see if the child is dry, and take note of how long they can hold their bladder naturally. And anytime that you notice that the child is dry, you're going to offer fantastic praise for that. You're going to get them going with that routine that, wow, you stayed dry, and there's some sort of reward for that. And then you can move to a prompted toileting schedule. So if you have some idea of how long the child can stay dry for, you can set your toileting schedule. And as Rebecca said, the staff involved is going to be necessary because you will be taking the child to the toilet as frequently as you possibly can. So if you can start a schedule 30 minutes, every 30 minutes, if the child can't stay dry for 30 minutes, or you can go up to 60 minutes or 90 minutes, depending on where their baseline is, do go ahead and start taking the child to the bathroom on that prompted toileting schedule. So at the time that you are ready to start the toileting, and say you bring them to the toilet at 9 o'clock, you're going to, at that point, choose the appropriate communication tool that they will eventually learn to use when they have to go independently. So this time you're just offering the ability to practice the routine. When they say exchange a picture of a toilet, you would teach them when they do that, they can then go to the bathroom and relieve themselves. But even if they don't have to go to the bathroom and you're prompting them, you're still going to want to practice that routine. So it might seem a little funny at first that you're going to be asking the child to communicate that they need to go to the bathroom, but you'll see in the end that that is how they will get to know how to communicate with you in the future. So it could be a word, it could be a sign, it could be a picture, but go in those steps. Do dry checks and praise, a prompted toileting schedule, and then the communication tool. So when you take them to the bathroom at 9 o'clock, for example, clearly if they void in the toilet, you're going to throw a big party, and I'll show you what happens when that happens. And as I mentioned, these are some of the sample essential visuals that we encourage. So Rebecca brought up some fantastic examples of why a child might need to work on routines for those readiness stage goals. So using a toilet routine visual is going to be really important for the child. They can get practice using the visual, and it's going to stay the same every time. So you don't want to switch it up on the child. You want to make sure that you are using the same visuals every time, using the same routine every time, because then you find that their comfortability is increasing with use of those visuals. And then this toileting request visual could be the example of what you would exchange every prompted toileting time. And then the first then visual is what we discussed earlier. How does the child know when reinforcement is coming? Well, you can communicate with the first then board. First we pee in the toilet, and then you can have your fantastic yummy cookies. Next, it's important to go ahead and teach that sequence. So using that visual schedule or something like a video model to teach the sequence. And then for those kiddos who really do have difficulties for sensory reasons that Rebecca brought up, we might want to consider going really slow when it comes to asking them to go into the bathroom. So let's just say they are terrified of the sound of a flush. I've worked with kids like that here in the center, and what we've had to do is what we call a slow exposure technique. So we're only going to move slowly on that specific skill before we do anything else. So we know that the child hates the sound of a flush. Let's just ask them that one morning to stand near the bathroom door. Can the child tolerate that? If they can, give them some praise. And then maybe after a few days of them tolerating that with no sign of distress, we want to add, maybe today, let's touch the door, or you're successful there. Can we step inside the bathroom for 1 second? Again, lots of praise, lots of motivation there with reinforcement. But then can they stand inside of the bathroom for 5 seconds, 10 seconds? Can they then walk to the toilet? Can they then sit down on the toilet? What you want to do is to make sure that there's no distress at any point in this schedule, and then you can feel comfortable that they're going to be more willing to sit to make an actual void, but don't push them too far. We can't ask the child to run before they walk. So if your child is experiencing a fear of the bathroom and they won't even go in, and these are some sort of problem-solving tips you could use. And then for the kiddos who don't sit for a long period of time, or they get a little squirmy, or they just have difficulty waiting to transition to the next activity, using a timer is something appropriate that you could consider using, so that they understand just how long they're required to be on the toilet. Sometimes it's just that lack of receptive communication, that they had the understanding that, this is what is required. The priming will help, but when in doubt, bring in a timer. I like the idea of turning on a consistent song. So let's just say it's a toilet time song that they like, or even just a pop song that they enjoy. That might help them indicate that, we'll sit on the toilet as long as the song plays. And once the song's done, you can get up and go. But it connects to something that they like, which is also a suggestion we have.
Again, with these kiddos that do have sensory sensitivities, you might want to just adjust the lighting, the warmth. Can bring in heaters. Sometimes it gets cold and chilly when you're in diapers in the winter. You might want to put on like a calming white noise or remove scents, or sometimes you might want to add a scent. You know your child best. You can allow comfort items, but with a caveat that that's not their most preferred, and we'll get to why. You don't want to offer their favorite things in the bathroom unless it's contingent on voiding, because the voiding is what we're looking for here. And of course, if you don't have a little stool for their little feet, please be encouraged to add a stool to keep them comfortable. And so here's what I think is most important topic of the day is keeping in mind the reinforcement that you're using for the job well done, for the void in the toilet. So you are going to ensure that you know what the child likes as reinforcement, and you are reserving that. So using that special reinforcer for only toileting. So if you can, keep the child away from that reinforcer any other time in the day. That is ideal, and that will, as I think Rebecca knows, lead to the quickest success. We have so many stories where once the reinforcer was reserved, it made a huge impact on the child's success rate and how fast they were independent. So you can say things like to the child, your reinforcer is going to go into a treasure box, and the treasure box is only going to open if you pee or poo in the potty. So you can still offer praise along the way. Going near the bathroom, they're going to get some verbal praise. Sitting on the toilet, maybe they get some tickles, cuddles, a movie. But if they pee or poo in the toilet, that's the time where you don't want to miss. You want to immediately open up that treasure chest and throw a huge party, because some children I found who I've toilet trained in the past don't even recognize that they're voiding when they're voiding. So you might need to even startle them into understanding that it's happening, because it might be a first time for them. I've seen children cry when voiding in the toilet for the first time because they don't understand that sensation. So again, just that reserving reinforcement, because big jobs need big prizes. And then consider documenting, because we all forget things that happen. It's a whirlwind of a day. You have so many other kids in your care and lots of other things going on. But when you document, you actually do give the child a voice. So the more data we have, the faster we can fade our support, which is good. We get rid of the diapers, we move on, the kid's happy, we're all happy. These are a couple of things that you can consider documenting. The current schedule. So say you start a 30-minute schedule, and then you notice that the child is voiding in the toilet, and you want to increase the amount of time, the length between prompts. So now you want to boost it to, I'm going to take the child every 60 minutes. Well, now you're at a 60-minute schedule. It might be appropriate for everybody to know that that's the decision that you've made, parents included. And then again, the goal is to continue to move the schedule to a higher time, so 90 minutes. Keeping that documented would be key. And then document success. So when roughly did they void in the toilet? What days didn't they void? Or what days did they have accidents? Record those accidents. You might start getting a feel of a pattern. And then maybe you want to, as over time, if there too many accidents are happening, go backwards in the toileting schedule. So reduce the length of time that they're required to go without prompt to the bathroom. Clearly you want to document initiations, because you're going to want to throw the biggest party and tell the world if a child has initiated the bathroom on their own without a prompt. That is the end goal in all the stages. So we want to make that known, that was the top tier thing that a child could do is ask you to go to the bathroom and void. And then reinforces that work, document, because sometimes you might notice that reinforcers change over time. So you might have started with reinforcing the child with their favorite cookie, the cookie that they request 99 times out of 100. But sometimes the child will satiate off of those reinforcers, and they'll want something new. So you might notice that it was working to offer the child a cookie reinforcer, and then all of a sudden they have accidents again. Document that, because we want to make sure that we don't go stale and we don't continue to offer things that don't work, and then you'll get a feel for what to do next. And so I think here is an important for you to realize the job that you're doing well as well. So what about accidents? So we know that accidents are a part of the progress, are part of the nature of toilet training. We've dealt with a lot of them over time. We strongly discourage any punishment or timeout. Any indication that the child has done something wrong when they have an accident, we want to avoid. You don't want to take away any of their favorite items or have the child sit longer on the toilet due to an accident. Don't involve them in the cleaning process. That will not encourage faster toilet training, actually might discourage toilet training altogether. So we're keeping it positive. So what about accidents? These are things that we encourage. We want you to say, when you witness an accident, just simply say, stop, pee goes in the toilet, and then promptly